Alright. Any other questions or anything else? Yep.
I wanted to know if you had received any complaints surrounding the Victoria harm reduction meter exchange on Wall Street?
Oh yeah, we've received several. Yeah, I mean, I guess, unfortunately, our department has been working with a wide variety of service providers, including the neighborhood associations, in balancing public health with public safety. Harm Reduction Victoria, they have chosen to ignore the recommendations and significant work done by the Needle Exchange Advisory Committee, and the concerns of the community around Needle Exchange services. I see in the paper. I'm not sure what's your name.
My name is Luke.
Okay, Luke. I just know one of the gentlemen from the harm reduction basically had said in the paper today that they're not a service provider. They're a lobby group, and for such, they're not going to listen to anybody else's concerns except for those of the drug user. Obviously, the decision that they've made here will ultimately undermine their credibility in the community, I think, with not taking into account the considerations. I mean, for those that lived on Cormorant Street, the exchange was a failure at the time. We believe that everyone involved, users, service providers, the people that live in the community, they need to have an equal voice at the table, and their concerns need to be heard and valued. And that's not the approach that harm reduction is taking. So we'll monitor that. But there is, I mean, common sense would tell you that it's probably not the best way to handle. I mean, they have an agenda, and they're definitely focused on one aspect of that. And common sense tells us that handing out needles within a block of an elementary school probably isn't the best way to get your message across.
Have you increased patrols of that neighborhood?
Yep. Yeah, we always do. We always have constant presence there. We were there again this morning. We have regular attendance by our mountain bike officers, beach squad officers, patrol officers. We're constantly in and around that area.
So you've increased them since Sunday when they started?
No, it's just we've always had an increased presence there. Obviously, Sunday we were there. We monitored that rally, and we are going to monitor the harm reduction and their efforts there, and the actions that they're doing with handing out the needles.
Do you know if there are any plans on doing any legal action or enforcement or surrounding this issue?
Well, I think we're in discussions with the Needle Exchange Advisory Committee in the City of Victoria around, what that's going to look like. We can't prevent them from handing out the needles, but obviously we would encourage them to consider the neighborhood, the concerns of the residents that live there, and they don't realize a lot of people that are battling drug addiction, they don't want to be around that either. They talk about harm reduction, and I think harm reduction gets more and more focus, but there's less focus on treatment. And that's sometimes that gets lost in the discussion, and treatment is a really important issue, even more so than harm reduction. So we'll continue to monitor that. But I know that needle exchange services have been around for at least 10 years. And I know that we believe in the harm reduction model, we believe in that philosophy, but the incidences of communicable disease being transferred, HIV, hepatitis C, have soared, even though there has been needle exchange services for the last 10 years. But we do support those efforts as a public health initiative, but our focus is public safety, and we need to find the balance. And the Needle Advisory Committee was doing that. We support a mobile exchange service. We have seen a significant reduction in the street issues since the Cormorant Street location closed down. We worked with the AVI and Needle Exchange providers to find a route that was suitable and could still meet the needs of the clients. But what we're seeing and what we're hearing from the drug users is that drug trends are changing. There's not as much intravenous drug use. Everyone is smoking crack cocaine. So the fact is that they're not getting as many needles in isn't just related to recovery efforts. It could be the changing in drug trends too. And so as a police department and as service providers, we look at the entire issue, right? And that's what we're hearing from the drug users and the drug service providers. And we do believe that there is of value in the mobile exchange site. We also are supportive of fixed sites. What those look like, maybe multiple fixed sites perhaps, whether those are just your standard walk-in medical clinics or pharmacies. I mean, those are in every neighborhood. Looking at some sort of model like that. But if they're going to have a no exchange, it needs to be, resourced and run appropriately and professionally. And so we're working obviously with the exchange advisory committee to get to that point. Anything else?